My goal for this presentation is, what I did here is I just put together some of the studies or elimination projects that we did with different companies and different colleagues. And as I mentioned at the beginning, we are heading to the third year of Seneca virus in terms of outbreaks, and then we still need, or the industry per se needs to address the questions of living or not with an endemic vesicular disease and the burden of ruling out that disease when we have clinical signs on outbreak. So basically what I did here is just putting together 3 elimination projects that we did, one with Swine Vet Center, one with PIC, and one with New Fashion Pork. So, of course, all this team here in each one of the studies or the elimination project were very instrumental to get a lot of stuff in the field done, and we have learned a lot from each of the projects that we run over the 3 years. And I line out the cases or the project as yearly. So we have 2015 that we worked with Swine Vet Center 1, 2016 with PIC, and last year we worked with New Fashion Pork in an elimination project. And what I did here is just walking through how we learned since 2015. Okay, so we kind of go over each one of them, and I can skip some of them if we are kind of running out of time. So just as a background, again, we're comfortable in living with vesicular disease. We have a lot disruption on the processing plants, reallocation of diagnostics resources to ruling out FMD, some poor performance, especially in endemic in finishing sites. That was something that I haven't seen more recently in those continuous flows, in finishing flows. And increasing cooling salts rates, and neonatal mortality, as Matt just spoke about that. So I will start with the first case, and if you look at the date on this first case, it was August 15. And Dr. Dio showed one of the graphs, and when the disease emerging in the U.S., and it was right after we started seeing outbreaks and cases of SVV at that time. So, and the point that I want to get across is that we didn't know much or pretty much anything about how to control the virus at this point. Okay, so we have a sow farm operation here, a commercial farm. It was PERS negative with pretty good biosecurity, and this is the side that broke, and this side we were going to keep it negative all the time. And here's just 2 flows, winter finishing flows that feeding from these 2 sites here. So we have this site 1 broke specifically with vesicular disease at first, and then we have neonatal mortality later on, and a couple weeks later after the vesicular disease outbreak. Before that, the PCR and IFA from the sites, and then after the break, we had historical samples saved in the lab. When we test those, they were all negative, so we are indicating a naive population being exposed to the virus. Around 80% of the sows with snout lesions, and here we did have also some lesions on the foot too, so lameness. Here's an example of that. Neonatal mortality a couple weeks after, which is kind of interesting. If you look at here the production data, we go from 10 to the 22 in terms of pre-weaning mortality. And then after a couple weeks, and then transient, as Matt mentioned before. But the week after the 29, we did have a spike on stillborn, which we would think there's perhaps intraplacental transmission. And as Matt showed, we are relating at this spike in the stillborn probably with the poor lesions that the sows suffered a couple weeks before. So, and the lesions that I mentioned is mostly on the coronary band and the vesicular lesions on the feet. But that's an interesting point if you look at production data, or if you get used to look at production data in a farm. Here's just a video with the vesicular disease. I'll skip that one. So at that time, we didn't know much or pretty much anything about the virus. So we think there's a couple of things that we would decide to do is doing nothing and allow the virus, and a natural exposure to the farm, to the virus along the time, or are we gonna intervene and expose the herd as a whole herd exposure protocol. So we choose that one, and that was a nice opportunity to get some research done in terms of starting to understand better the virus. I mean, there's a lot of data that Matt and Dr. Dio show in terms of shedding. So this was kind of one of the first field attempting to understand the shedding pattern of the virus. So weekly collection in sows and different type of samples, and I'll show some of the data. There's a lot of data that was already shown here. So we have fecal shedding in 4 weeks, and we have really early immune response, and at that time was a really surprising that. So you can imagine we didn't know anything about the virus, and then on the first collection, on the same couple of days after the break, we go and collect serum and we detect 17%. So our first thought at that time was, the infection has to be 2 weeks before. So the farm was already infected. And then we detected later on. And then when we started collecting more data and building more research throughout the years, we find out that the IgG response or IgM response is pretty early on the game. So we didn't know at that time. So it was pretty surprised for us having that spike pretty early here. Another hint that regarding the tonsil and the persistence of the virus on the tonsils was the laryngeal swab that kind of kept it positive until 4 and even 6 weeks after the break. And that, of course, laryngeal swab is not the same as a tonsil tissue, but that's something that we're starting getting more surprised in terms of how this virus move around the farm. And this here we detect a short viremia too, as the others has been reported. So what we did at this point here, we just use manure or fecal samples from the affected sows, and we expose the feedback in the sows here, but also in the GDU. So in the gilts, they were already there. After a week, we collected the samples from the recently exposed gilts, and we started feeding again the sows. And this cycle was 1 per week during 6 weeks. And the reason for that, mainly it's because when you got the PCR results from the feedback, we can see that there's not much virus hanging around the feedback there. So we're starting getting these results and being a little more frustrated, and then we'll just keep going and see how at least maximizing the feedback. So after that, we got about 80% of seroconversion, so we are more comfortable and say that the animal got exposed to the virus. And then we started getting PCR negative around March, and then we open up the herd to naive gilt introduction on May 31st. It was more or less a long period at that time, but we want to be more confident. And they were, and again, this will change. If you look, we're going to walk through the other cases, and this will change, of course, depending on the demand of the farm, right? We didn't have, in this farm specifically, much pressure to introduce gilts. Usually they introduce gilts once a year, so they were okay and kept it closed for almost five months. So as I mentioned in one of the questions that we did a follow-up, and we find IFA positive consistent in some in the animals that were exposed about 108-ish days after the exposure. So the lessons learned from this first attempting to understand the virus dynamics in the farm and also to expose and working in an elimination project was we felt that it was possible to expose and eliminate the virus in the farm. We understand a little bit at that time the dynamic of the shedding and the infection in the farm, and the fecal and the oral, especially oral fluid, as a good sample to monitoring the herds in that sense. Of course, at that time, there was a lot of to be learned, and still a lot of to be learned through the virus in terms of the dynamic of transmission, environmental persistence. I will touch a little bit about that, and the impact in downstream flows in nursery and finishing pigs. The year after, we had the opportunity to work with PIC in a multiplier that broke with SVV. It was a high biosecurity multiplier with 4,000 head. And the clinical situation here, the first clinical scenario was neonatal mortality and scarring and not much consistent on that. But then days after, the vesicular disease in sows appears, and then in all those cases, we got involved with the Board of Animal Health and ruling out FMD. When in this specific one, we have the neonatal mortality kind of coming first. So we also have here is just the configuration of the site. We have the sow farm, the quarantine, and we have these two downstream flows site for the wean to finishing. We have the opportunity to working on the elimination project and segregate the weaning. So we did have a site that we can direct the pigs that were positive. So we closed this site here and tried to expose mostly of the animals too. So closing elimination was chosen at that time too instead of natural exposure. And every time that on the first one, on this one, and on the third one that I will show you, we always, from a university perspective, we're always trying to get something and learn something out of that. So in this case here, PIC was at that time concerned about having a well-established protocol, especially because this herd will be, it's a breeding stock, so they will be selling animals afterwards, and we want a well-established and comprehensive protocol. So we decide that follow the protocol ASV recommended for PRRS. And when we think about the ASV and the protocol recommended for PRRS, one of the important measurements that we did in this case that is important for PRRS, it's weaning pigs that is PCR negative, right? That's one of the bases of the protocol. So we establish and define a population, and we are focused on weaning negative pigs. So we confirm the infection, close the herd. The feedback in this case was feces, so we're kind of getting the same experiencing from the previous one. So at this case, we have a lot of diarrhea or mortality in piglets. So we use the gut homogenate from the piglets, and we also have some contacts with sows in the alleys of the farm. So we let the sows going in the alleys and have direct contact or nose-to-nose contact with other susceptible pigs to increase the exposure on that. As I mentioned, segregate weaning, and we started monitoring the clinical signs, and from here, we started seeing negative pigs at the weaning. So what we learned from here, and I'll show you later, that the weaning negative pigs for Seneca, it's not that hard. Relatively short period of time, you still can weaning negative, PCR negative piglets. However, one of the catch-ups that we have here was the persistence of the virus, and I will show you that later. In this case, for example, we use sentinels, so we introduce the sentinels and monitor the sentinels, and they keep all negative, and we started introducing goats 18-ish weeks after the closure. On the wean to finishing, so we stop all delivery, so we have segregating weaning. So both sides depopulated as the pig reached the marketing way, so depopulating and cleaning and disinfection, and then repopulating with weaning pigs. So the repopulation in this case, one started 25 weeks after the break, and the other one started 18 weeks after the break. One thing that we learned about this was relatively short period of the time for weaning PCR negative piglets. Remember that we used the ASV PRRS model for that. We also saw a robust exposure using the pig intestine and compare only with the manure that we have in the last case that we had with high CTs. In one of the wean to finishing sites, was interesting to see the positive PCR in oral fluids even 90 days after the infection, which Oral fluids, you can interpret that in different ways, and most of the cases they are just environmental samples, so you're just kind of picking up the virus from the environment and from the saliva. In this case here, when we start seeing this example, we start thinking more on the persistence of the virus. Kind of the same time that we start kind of looking at in some trials at the U here to look at the persistent and the resistant to some disinfections. So we kind of wonder and focus on that on the next experience that we have. Last year, this is the last case, and I'll put all together. We had an opportunity to work with Deb Murray at New Fashion Pork in a commercial sow farm. That was a very, very high biosecurity farm. It was PRRS negative, and the biosecurity data that they have was pretty consistent, and it broke with SVV in January of 2017. So the way that this system works, they have the GDU that was negative, the farm one that was negative, and they have the P1 and south for this older farm too. So they run kind of paired with the other 3,000 sow farm. The clinical scenario that we saw on that one, and again, we're always looking for learning in one of those cases. So we also had the first clinical sign as a diarrhea and neonatal mortality. And then afterwards, we came to see the vesicular disease. So as you can see, we had 3 cases. One was the first scenario was vesicular disease, but the other two was neonatal mortality. And for that reason, we include here in at our lab to monitoring and test every neonatal mortality or every cases of increasing pre-weaning mortality for SVV. Maybe this will be one of the hints that kind of prior to the vesicular disease. And we're also encouraging the vet practitioners to come back if we got a positive and look at the sows for vesicular lesions. Okay. And that when you're talking about a vesicular disease and an FMD indistinguishable disease, it becomes a little tricky because we're starting seeing diagnostics of hundreds of diagnostics of SVV. But then if you go to the USDA or Board of Animal Health, you see 3 or 4 cases of SVV. And where does that come from, the hundreds and hundreds of diagnostics of SVV, without the involvement of the USDA and the state vet, right? All the hundreds of diagnoses of SVV, mostly of the cases are related with neonatal mortality. So if you have a neonatal mortality and you have positive for SVV, is that necessary to contact the USDA or the Board of Animal Health because you don't have the clinical picture of vesicular disease, right? That's one of the points for discussions with the industry that we had at that time. So in terms of lesions, more the same. Here, of course, we choose to close and do an elimination protocol. And in this case, I mean, compared with the first one, in this case we have a little short in terms of room for the elimination project because a little more pressure of introducing gilts sooner. So we would be really, really sure that we are doing here in terms of exposure and measurements. And to take the opportunity to learn once again, and this time, based on the previous one, we start thinking and learning more about the environmental persistent and also some aspects of transmission. So we took a subset of sows, so we also have air samples and environmental samples to see the persistence of the virus in at the sow farm. Remember that the previous one, we were fine in terms of weaning negative piglets. So here's the exposure plan. We fill up the GDU, and then we had the contact with the sows. And we also have the nose-to-nose contact based on the previous success that we have. In this case, we use the heat checking bores to go around the areas on the farm and contact with susceptible animals. We were lucky, and this is rare, to collect about 14 mLs of vesicular fluid. And then we kind of made our inoculum using that one and diluting in PBS. So we use a dye from BI and as for the vaccine and materials, and then we kind of expose them. And the exposure was intranasal. So here's the picture of our exposure. So we exposed that intranasal. That was, I believe it was 0.5 mLs, and the virus, there was a lot of virus on the sample. So 7 days post-exposure was one time. Okay, we didn't repeat that. So we have PCR positives and pretty confident with the exposure, with the IFA, 96% of the animals getting seroconverted. So the exposure were pretty significant on this point. The other two cases that we used feces and intestine from the piglets, we didn't have any clinical signs on the exposed sows, okay? And in this case, we have 5 animals showing blisters and clinical samples. Basically what we did is pretty much reproducing the disease in a small scale here at the farm. So what we learned in terms of the environmental persistence here, here's the PCR results, and when the bars reach the 35, it means that we're starting getting negative. So focus on the air sampling. We did detect positive air samples on the first 2 weeks of the break, okay? And then after that, the air sample is starting getting negative, but if you look at the environmental samples, the crate fairing and the gestation, the crate gestation, it's basically swabs or Swiffers in the crates, right? That's what we did. And they're keeping positive for long, up to 10 weeks. And if you look at here, the little difference in terms of persistence, more on the gestation barn compared with the crate, or with the fairing. And the reason for that is that because on the fairing room, you can empty that and wash it up. And in this case here, they use hydrogen peroxide. So you can get rid of the virus easily in a fairing room because you can empty all the fairing room and do a significant cleaning on that one, which doesn't happen on the gestation barn. Okay, which basically what they did here is cleaning as they remove the sows and as they go behind the sows there. So pretty significant persisting on the environment on this one. We did follow some of the piglets that were weaning at the time of the break, and we detected some serological response at the weaning, but then follow the same piglets at 7 days of age. The antibody levels decay pretty significant, which make us think that those antibody was probably from the sows, and which make us even think more if in the downstreaming flow, these pigs or the piglets from infected sow farms, they are probably susceptible when they got at the finishing age, right? So the take-home message for us here is that even if you have a sow farm exposed, you may have a lot of finishing pigs susceptible to the virus there. Here's just an interesting finding that we found on this case. We had boars shedding the virus on the semen for longer. And this presentation was actually last year, so I was a little bit surprised. And I just put this up there because what we have, including virus isolation on the boars, we euthanized the boars before we opened up the farm, right? The boars weren't shedding the virus on the oral fluids on the fecal, but they had a significant shedding of the virus on the semen. So we don't want to open up the farm with having boars shedding the virus on the semen. So we euthanized the boars and removed those before we open up the farm. In this case was around 4 months after the closure. So we did include sentinel animals that didn't seroconvert, so we were more confident in opening up for gilts, and the sow farm is still negative up to date. So what we learned in this one is the incredible environmental persistence of the virus, including viable virus that we did virus isolation on it. Potential aerosol transmission on the first week of the break, first 2 weeks of the break, and a decay on antibody levels by the end of the nursery that makes probably they're susceptible at the finishing sites. That's one of the questions that Dr. Dio talked about, and Matt showed some results on the tonsils. And in these teasing boars, we did see positive boars 90 days after the clinical signs, which make us think on the possibility of the potential carrier state and the potential transmissibility of the virus. And then, thinking about a carrier state, and if there is transmissibility of the virus on those animals, pretty much everything that we have done and kind of goes to the drain, right? Because if we are not able to detect animals that are carrying the virus on the tonsils, you think you eliminate the virus on the farm. But maybe, perhaps, the viruses are still hanging around there on the tonsil tissues of the animals. Just finishing up and compiling all the cases. We have 1 multiplier and 2 commercial herds. And again, neonatal mortality might be an important hint for the break. In 2 cases, we have event that we call prior to break. In the first one, we have transport of gilts using Kuhlsaw truck, because the gilt truck was broken at that time, so they used the Kuhlsaw one. So this was 3 days after the break, before the break. So that was something we couldn't associate it with the break, of course, but we just record the event. And here we have delivery of the semen from an external or a non-conventional source on the third one. We don't know if that's significant or not, but we are recording that one. The exposure methods varies a little bit. This is the only one that we use vesicular fluids. We're persistent in the ones that we use feces, mostly because of the low levels of the virus, and the time of the closure. 20 weeks or 28, and if you look at, if you take the data from PERS, MICO, and PED, the closure time here will be more towards a PED elimination program than PERS or even MICO, which is way longer than that, 2050 or 150 or 120 days. With that, I finish acknowledging all the partners that I have been working with.